How is a skin biopsy performed during an exam? Imagine noticing a mole or skin spot that just doesn't look quite right. During a skin exam, if your healthcare provider sees something suspicious, they might recommend a skin biopsy. This is a simple but important procedure to help figure out what's going on beneath the surface. The process starts with a thorough review of your medical history, including any medications you take, allergies, and if you have any bleeding issues. This helps ensure the procedure is safe for you. When it's time for the biopsy, the area to be tested is first cleaned with an antiseptic like alcohol or chlorhexidine to reduce the risk of infection. Then, a local anesthetic is injected into the skin to numb the area. You might feel a quick sting or burning sensation, but it passes quickly. Once the skin is numb, the provider uses one of several techniques to remove a small sample of skin. One common method is the shave biopsy, where a thin layer of skin is shaved off with a small scalpel or razor blade. This is often used for raised or superficial lesions and usually doesn't require stitches. Another technique is the punch biopsy, which involves pressing a circular tool into the skin and rotating it to remove a deeper, cylindrical piece of tissue. If the sample is deep or the lesion is large, 1 or 2 stitches might be needed to close the wound. The third method is the excisional biopsy, where the entire lesion is cut out with a scalpel and then closed with stitches. This is often done when there's a strong suspicion of skin cancer. Once the sample is taken, it's carefully placed in a special container with a preservative and sent to a laboratory. There, a dermatopathologist, a doctor trained in skin diseases, examines the tissue under a microscope to check for cancer or other conditions. After the procedure, the site is covered with gauze and a bandage. You'll receive instructions to keep the area clean and dry, usually for at least 24 hours. Most people can return to normal activities soon after, but it's best to avoid strenuous activity that might irritate the site. While skin biopsies are generally safe, there are small risks like bleeding, infection, or scarring. These are rare and can be minimized with proper wound care. Results usually come back within a few days to a week. If the biopsy confirms skin cancer, your healthcare provider will discuss the next steps for treatment. If it's benign, you might not need further treatment, but monitoring or removal for cosmetic reasons could be recommended. In the context of skin cancer and maintaining healthy skin, a biopsy is a vital tool for early detection. It allows for accurate diagnosis and timely intervention, which can greatly improve outcomes. Regular skin exams and prompt biopsies of suspicious spots are key to preventing advanced disease and keeping your skin healthy. Always consult your healthcare professional for personalized advice and follow their recommendations for skin health.